everyone, and welcome back to the Motivators podcast. I'm Brian Curley, Chief Creative Officer with Motivity. I'm here with Christy Ivanko. Say hello, Christy.
Hello, I'm Christy Ivanko. I am the Director of Operations and HR at Motivity.
And we're here with our guest, Michael Gao from Alpaca Health. Michael, thanks so much for joining. Tell us a little bit about Alpaca Health and how you got started.
Yeah. Well, first, thank you guys so much for having me. I've been listening to the podcast in the past couple months and really cool stuff. Alpaca Health, we're building AI tools for ABA clinicians. Our first product is an AI assistant for BCBAs that takes notes during parent interviews, parent training sessions, and BT supervision. So imagine recording those sessions so that a session summary is automatically written, and you also have nice action items for a parent or for a BT that you can send them from our platform. We also help with treatment planning. So we take the parent interview and combine it with client records to generate whole parts of your treatment plan. And we're working on something for BTs to use to help with their session notes as well. So lots of cool stuff, hopefully that will help clinicians save time and spend more time with their clients and not on paperwork.
So Can I just ask, you said that it takes notes. Is that like a full transcription or is it generative? It sounds like the treatment plans are generative, but maybe the notes from the supervision session, is that just like a transcription?
Yeah. So it is both
like
a transcript.
Word for word?
Yeah. Yeah. It's both a word for word transcript so that you can go back and reference every little detail of the interaction if there's anything missing, as well as a generative portion that is a summary and high-level bullet point highlights of the conversation as well. And if you read those high-level highlights and see something missing, there's always a transcript that you can search through. And we're working on a feature to let clinicians actually chat with AI. So if they remember something was said but can't find it, they can just ask AI to find it for them.
Mm-hmm.
Interesting.
Yeah, it's super interesting. So it's all audio then. There's no video. It's just an audio feed like that's coming in.
Yeah, and for at least for right now, because when you think about parent trainings, interviews, BT supervisions, most of those interactions are auditory. Now, direct therapy sessions are obviously a little bit trickier, given how physical, tactile, chaotic, around the room, multiple rooms they are, and so we've experimented with a couple of things to leverage video, but that is still really in its nascency. We're sort of doing research, working with a couple of design partners to test out. The audio piece is the piece we're more confident in and have actually released at this point for about a month.
Okay.
That's cool.
So like, what are your thoughts, or like what are you thinking from like a product standpoint that, you know, maybe everything that needs to be in the note isn't said out loud?
Yeah, it's interesting because during a parent interview, especially, right, they might say something where you as a clinician have an insight that you don't want to say out loud to the parent because for many number of reasons, right?
Yeah, of course.
And so we definitely heard that. And one of the things that we want to incorporate is sort of like a more subtle note-taking feature where on your phone you can kind of like click a button that's like, red flag, come back here, or other types of live annotations to help solve that.
Cool.
I do think that this is probably something that you have to like still do a little bit of your own manual note taking. If something isn't said auditory, then our AI isn't going to be the best at picking it up, since it uses audio as the biggest source of truth. But for the most part, it seems to do how I would describe what our AI technology does, and frankly, all AI technologies in the field of ABA, is it gets you 90% of the way there, and the 10% left over, like that's where the clinician's magic really needs to be focused in and happen. And that's where hopefully clinicians can focus with after using our tool.
Well, I wonder too if it starts to shape behavior. Like if as a clinician, I don't narrate maybe as much, but if now I know that, or I've seen notes, I start to narrate maybe a little more. Certainly not things that I can say aloud, but I might say, something like, oh, mom, you just indicated that bookshelf over there as a problem, just to sort of reiterate maybe something that happened gesturally, that it might change my behavior. It might shape my behavior in that respect, I would guess.
Yeah, that's a really interesting thought. I mean, one of the things that we have seen clinicians do in a way that we actually didn't anticipate and didn't intend is actually a dictation tool. So instead of recording the session as it is happening, they're recording themselves speaking a summary into the AI after the session, say on the car ride back to the office or to the next session, or like in between rooms in the clinic. And they have found that to be just like an easier modality for explaining the session than typing, or using your iPhone's pretty bad, right? Speech to text tool.
Mine still doesn't know my name. I know. It's just... or my kids' names. I don't know why. Yeah.
Yeah. So are you, like, when it comes to like taking the dictation that you're getting and doing some magic with it, like whether it's AI and some big language model, like, are you, my first thought comes to, well, you're working with a kid and they're saying something like, okay, what is this? Good, fire truck, right? Or something like that. So then, like, are you building intelligence in to know what they are working on versus what they're not working on versus, oh, great, you mastered that one or something like that means like, okay, that's, like, are you thinking about it more in terms of like the detailed raw data that's actually happening?
Yeah, it's such a good question. And it's a difficult one, right? Because oftentimes these goals for treatment plans are stored in, right, like a central reach learning tree or like a Motivity, or another data collection platform. And so we certainly wouldn't want clinicians to have to redo those goals for every kid in at least two platforms, if not more. And so it's something that we're trying to be thoughtful about, think about how we can better integrate. But I mean, if you kind of take the sort of full length of the experience, a clinician first defines goals for every single kid. And if our AI can understand those goals, they can better keep track of behaviors, the things that a parent is saying, the things that a BT is saying, and better flag those up in summaries, in highlights, and maybe contribute to data collection that continues to be highly quantitative and data driven, but also has kind of like more color around the subjective analysis of parents, of BTs, that aren't captured in the numbers, but are sort of just the impressions of people around the child, which I think can be equally important, but hard to track in a kind of pure numbers focused data collection framework.
Right.
Do you allow, I wonder how much shaping can go on the other way? Like, can I actively teach the tool or however it is to recognize some things? Or I don't know. I was thinking of, and I'm going to date myself really badly here. I worked for Intel in the 90s. And there was a tool, I don't know if you remember, or maybe you don't, called Ask Jeeves. Do you remember?
I can't say I do know what this is.
I know. But anyway, when I was working at Intel in the 90s, there was this tool called Ask Jeeves, and it was the first kind of learning, like it would learn how, rather than doing a Google search where it would just go out and search, it would start to learn things and give you answers in a more educational.
It was like a response to your question. Exactly. As opposed to search result.
The more you use it, the more it would learn the types of answers that you want. Is there a feedback session or, and I don't actually know how it worked because I didn't understand it back then. And I don't know what the code was behind it, but is there some sort of a feedback session where I can say, yeah, I liked that you did this. No, I'm not so happy when you summarized it this way. I prefer it summarized that way. Is there a way to interact with it?
Yeah, I think that's the beauty of what AI can be, is it's sort of self-learning based off of clinician feedback. I think that we're still trying to be thoughtful about how to do that in a HIPAA compliant way, in a way that doesn't, right, have kind of privacy implications. So right now, there's not the self-learning feature, but we think it's something that we can add over time. What we do have today, though, is the ability for clinicians to define what they want the AI to, I guess, look for out of every type of summary. And so in the same way that you can define like a template for a session note and a lot of the other systems, you can do the same in ours. And so you can say, in the summary, please pull out, like as an example, any behaviors that a parent has mentioned the kid has started, any behaviors that a parent has mentioned have intensified, any action items for the parent, any action items for the BCBAs, and that will create this kind of like output that has 4 different categories with each of those things in them. And so you as a clinician or you as a practice owner can tell the AI what matters to you and what needs to be pulled out. And so that's one way that folks can easily configure the AI to be a little bit more customized to what you want in your notes and your summaries when using the platform.
So it sounds like in ABA speak, we have effective the antecedent, the beginning, what we can prompt it to do, but not so much of the consequence in terms of teaching it. But I hear what you're saying about like the HIPAA issues and the privacy issues. And you probably couldn't, take data or bring everybody's data together because that might.
Yeah.
But it would be neat.
There's something when you talk about sort of like ABCs in ABA and how that's kind of thought about in the world of AI. Like, I think it's just very similar in a way where I think like behavior analysts actually probably have an advantage over potentially even like pure technology people and how to interact with these LLMs. All we do with LLMs is sort of like tell it things and coax it to kind of think in the right way, right? Train it to think in the right way. And that's all behavior analysts like kind of think about in their day-to-day work is like, how do I properly instruct a child or a BT or one of my admin team members to do what we want them to do? How do I set the right context? How do I break down this big task into 8 different small tasks that are a little bit more kind of easy to explain, where I can see where the kid gets up to 4 out of 8 of the task breakdown, he's good, but then starting at 5, she needs a little bit more help. All of that is how we think about prompting AI. And so I do think that there is this really interesting thing where I'd love to see behavior analysts using just plain ChatGPT more, because I think that like they're going to find really extraordinary use cases of it just from being really thoughtful about how to train and instruct and communicate things in the most detailed way possible.
I think sometimes it's hard for us to get away from the fact that it's our job to do these reports. It's our job to individualize our programs. And then when we start to use tools that maybe take parts of our job away, I mean, I don't necessarily think it's ethically a bad thing. I was looking on Facebook. I'm going to bring up one of our clients, High Five David Maddox. Somebody said, well, is this ethically an issue? And he's like, yes and no. And I thought that was the right answer. I'm like, yes, there are some issues here. And yes, and I'm not characterizing exactly, but I just thought it was a beautiful answer. And then like, yes, you've got some ethical issues with you should be individualizing your job. Right. You should be doing this work. But if it can help you do some things that are more automated, then you have more time to do this work. So then you're also being more ethical. It's that balance. But I think there's always something in our brain that goes, I can't use ChatGPT. I can't. That's I'm supposed to be doing this. I don't know.
But I think it's. I think we're starting to see that a lot of those tasks are changing in the world to where your job, like, is not to write a session note accurately. Your job is to do like the therapy properly and then document it in a way that's medically relevant, right? Let's just say. So the job could change from you strictly writing a note or writing a treatment plan to critically thinking about how do I prompt an AI to spit out exactly what I need, and I tell it everything that happened in a way that it understands with a format that I want, that blah, blah. That's going to take some time. That's going to be like another type of thing, right? You have to critically think of how do I want this thing output? What type of data do I want to feed it? How is it going to understand that data? Is it going to get the nuances? Is it going to get the sarcasm or whatever you put in there?
Does it get sarcasm?
So that it outputs like the thing that you want, right? Like that skill for sure. And like I find it all the time when I'm playing around with AI is that like the prompts are so interesting.
Yeah.
What you give it really
Yeah.
100% truly defines what it's going to give you back. And it reminds me more of like stripping it way down to like when there was a typewriter and then a computer, right? It was like the computer's going to take my job. It's like, no, you're still going to be doing the thing, right? It's just going to be in a different way, in a little bit different format. It's going to be faster, right? So I think this is a little bit different because like the output is different, right? Like you didn't physically type the output buttons, but like there's still a lot of your brain power that went into the output, So I'm kind of on the fence a little bit, but I think that's kind of where I see it going.
Yeah.
It seems a little bit better though, because I think that some of the fear comes from we've all taken a treatment plan and copied it and used, and then gone it, and then forgotten to change one kid's name or something. Wrong.
Yeah.
That's happened. I've never done that, but you have to start somewhere. But you do want to go. In this case, that wouldn't happen unless, of course, you said the wrong child's name in the session, because you are really starting from something that's more pure. So in a way, I would guess it's definitely more ethical than that. But I think that's where our fears sort of come from, and we have to get over that. Plus, not understanding how something thinks, and you can't really see its brain. And
yeah.
So how are you thinking of getting these language models to train themselves while still being HIPAA compliant? Like, what's your process for that?
Well, so I guess I think that there's something interesting about this sort of balance that we're trying to strike here about like what an AI does versus what a BCBA does, right? That we are more focused on right now than kind of like creating the best LLM model. We actually think that off-the-shelf commercial models like OpenAI, like the ones from Gemini, are actually like really powerful right out of the box. And they know a lot about ABA right out of the box in a way that even was surprising to myself and frankly a lot of clinicians who use ChatGPT. I think the difficulty with just using those products on their website is that they're not HIPAA compliant if you just use them as an individual user without paying.
There's no BAA.
There's no BAA. The data will be used to train AI models, and that is a scary sounding thing. And so our first step was just let's kind of get these business level agreements with Google and with OpenAI that says, hey, if we send you something, you won't use it to train your models going forward, so we can protect sensitive, HIPAA compliant, HIPAA covered information. So that's sort of our step one. Now what we're doing is sort of working with clinicians to understand where the right applications of AI are. And so the balance that we've struck is the paperwork that we do or the documentation that we do is the stuff you didn't want to do or you didn't think you went to a 2 years master's program to do. So I think like session notes really falls in this category, right? Like nobody went to a 2 years master's program to be like, I want to write medically, notes that frame my work in a medically necessary framework so that I can get reimbursed by insurance. Like very, very difficult to find someone who says that is an interesting part of their job. Treatment plans. I think the key part of treatment plans is goal writing, behavior support plans. Where do you think the sort of like pathway for your kid to be? But that really only is I won't say small, but at least only a portion of the treatment plan. So much else of the treatment plan is summarize the medical record, summarize the educational history, summarize the family situation, pulled from these client records and from the parent interview. And it's those seemingly very clerical parts of the treatment plan that we've kind of focused on. And so right now we're saying like, hey, like you as a BCBA have a lot to do already. the current way you do it isn't sometimes the most individualized because you're often just copy and pasting from templates or using really stringently defined templates from your company. Um, and now with AI, you can actually get an individually written paragraph for every kid based off of the information that you have told AI about the client in the interview and the client records and any other documentation you give it, so that we can make your work faster on the boring stuff so that you can spend more time on the really interesting stuff, the stuff that required a 2 years master's program to do, right? Which is goal planning, treatment planning, training your BTs, all the good stuff that it feels like there's just not enough time in the day for.
Yeah.
That's a good point.
Yeah. So on I guess we can dive into we kind of touched on the ethical stuff. Um, but I guess what kind of roadblocks are you hitting, if any? What kind of pushback are you getting from potential customers around these ethical concerns?
Comes down to just the uncertainty of what is an ethical use of AI. I think like this, our articulation is ethical use of AI does the stuff that doesn't require a 2 years master's program so that you can do the stuff that did require a 2 years master's program. It sounds great, but I'm just like one guy saying it, right? And so I think that, like we need governing bodies to come in and actually have a position on what is an ethical take of AI and ABA. And the BACB sent out this July advisory about if you're going to use AI, make sure to reference your ethics code. But it's sort of this like self-referential cycle where it's like, if you want to know what the ethical use of AI is, look at the ethics code. But the ethics code doesn't have anything explicitly about AI. So go back to the BACB, which refers you back to its ethics code. And so it's, I think, a very difficult place to be for a lot of clinicians who have kind of historically relied on standards, governing bodies, ethics code to think about their work, because there's not really clear guidance. And so I think that's a very reasonable take that we have in terms of what is ethical. But I do think there's some consensus building to do just generally in the community.
Well, I think it's probably the fear of the unknown, because the second they write guidelines, it's AI is going to change or something about it will change. You can't cover every aspect of it. And even the ethical code actually contradicts itself a lot of times by design. Like I think I teach ethics. I think the ethics code is beautiful. I think when especially the newest iteration, they did a wonderful job of capturing really most of what we do. But it's because not everything is clean. There's messiness involved in what you're doing. And sometimes this applies and sometimes that applies. So I think you can go back to the ethics code and say, all right, and I have the ethics code in front of me, because I don't always remember that, but am I 2.01 providing effective treatment? Am I section 3.01? Those are the overreaching, all these the 01s are kind of the overreaching. Am I making my primary responsibility to my client? And I think if you think about that, as you are doing anything, if you ask that question each time, or those questions, am I following these foundations? Am I living up to the foundations? Then each time you take a step, you can probably resolve that. But I'm sure the second they come out with a code, AI is going to do something different. And it's not, so I can understand why they don't.
That is, I think, is fair, right? It's like AI is moving at kind of like a very scarily fast clip, right? And so how do you kind of like govern it with standards around ethics, privacy, confidentiality in a way that kind of protects the craft, but also recognizes that new AI technology can be really incredible for the field? It isn't just like an ABA challenge. It's just like a societal challenge that we all have to grapple with in many ways.
I think the same thing with social media. Social media alters so much. It's very hard to come out with how do you, an ethical way to do social media, because the second you do, somebody does something completely different that doesn't fit, and you're like, well, how does that work? Is that right?
Yeah.
It's just always changing. It's a scary world.
Have there been any I don't know what you would call them, but like rules, laws enacted at any higher level, like for mental health or maybe just medicine in general when it comes to AI? Like, do you keep on top of that stuff?
Yeah, um, there's been some interesting developments in California around AI regulations in terms of disclosing that this is a document that was generated by AI, having an informed consent process for patients about, hey, we're beginning to use AI. Here's how it's working. And then I think another law that deals with how AI can or cannot be trained on kind of sensitive patient data and how that needs to be kind of flagged up in a more rigorous way than you may otherwise do with clients. I think some of those laws got vetoed in California. They're not all being pushed through, but I think there's sort of like a general push that most of the regulation is going to be on the privacy side and kind of clarifying what compliance means in a world of AI. And I
Mm-hmm.
think that's sort of what the biggest pieces of the ethics code that I think about are protecting client confidentiality, protecting privacy, document retention for 7 years. How does that work when using platforms that are driven by AI?
But I think the disclosure aspect of it is a little bit tricky because when you disclose, everybody has their own kind of idea of AI, and it's not always an educated
Yeah.
Right.
opinion about AI. So you may go to a patient and say, or a client in our case, and say, "Yep, I'm going to use AI for my notes," and they're going to know you're not.
Mm-hmm.
Once you get into that mandatory disclosure area, I think that even if you followed all the rules, even if you're sure or reasonably sure from a HIPAA standpoint that the data are safe or you're not
Yeah.
exposed to PHI, or you still may get societal pushback from people who have their own idea of what AI is. So I mean, I guess I can kind of understand it being vetoed or seeing. It'll be interesting to see just how it
Yeah.
goes.
I
Mm-hmm.
mean, we even recommend to the clinics, to the clinicians that use Alpaca Assistant to just go ahead and do the informed consent
Yeah,
process
yeah,
about
you've
this.
got to. You've got
Be,
to.
yeah, because, like otherwise there's just also this question like, why are you recording my session? And what is the purpose of this recording? And so it's just better
Sure.
in my sense to get ahead of it. And I think I've never heard of a parent saying no among the 17 design partners that have kind of helped build this tool, or the other clinicians that have now kind of like found our platform however way they have and kind of sending us an email. Nobody has replied saying, I've had trouble getting a parent to consent. Because I think if you sit parents down and just sort of explain that this AI is actually fairly innocuous, like it literally just like listens and take notes, and I'm going to look at the note before I submit it to insurance and send it to you. Parents are like, oh, okay, I guess. So like you used to spend 15 minutes at the end of our hour-long session writing notes, right? So do you have to keep doing that? And you're like, no, I can actually spend it with you now, and I can spend a full hour with you
Mm-hmm.
instead of just 50 minutes or 45 minutes or 55 minutes. And parents are like, oh, that sounds like a pretty good deal to me. So we haven't had a lot of issues when it comes to kind of parents pushing back, but obviously very early days and in terms of clinicians using the product.
Yeah. I've heard this was like maybe 6 months or 12 months ago that insurance was starting to push back on
Yeah.
AI generated notes. What's the story with that?
Well, it's so interesting because insurance is also using AI to evaluate notes.
Of course. Of course.
And they don't. And those 15 minutes that you take at the end of the session, they're not really billable. So
They're not supposed
if
to be
now I'm doing
billable.
exactly. So now if I'm doing the whole hour, maybe you're taking longer. But they're not. They're not.
Mm-hmm.
Yeah, they're not technically billable. Maybe they want you to take that time. No, I don't know.
Mm-hmm.
Yeah, I mean, I think that I think it's a little bit of an unknown question at this point, right? Like no payer has said absolutely no AI in the generation of session notes. Like that hasn't happened. And there hasn't
Okay.
also been a lot of advisory from payers about AI use. Like the BACB probably has more that they have said on that topic than payers have. But I do just think about a moment where I think United Healthcare got into a little bit of trouble a couple of months ago because they were using AI in their prior auth process for medicine, and they were denying things at a much higher rate than they previously had in a human-driven way. And that seems quite bad. And
Yeah.
so I
Yeah.
do think there's definitely a couple things to watch out for when payers start to use AI technology. And the goal financially from a payer is how can we utilization management down the amount of spend we have to give to our members. And so I am very wary about how payers start using this technology.
Yeah. Yeah, I would
Interesting.
be too. I would be too. So fill us in on what's the roadmap? Like what's next for Alpaca Health, and where do you see the products going? Are you gonna build more features, more different products? Like what's your roadmap?
Yeah. Well, so today we have the ability to take notes during parent interviews, parent trainings, and BT supervision sessions, audio only. We have the ability for clinicians and organizations to customize each one of those pieces to tailor the note to them. We're working on something for behavior technicians to use to dictate their session note and have that generate in a compliant way, uh, grammatically correct, spelling error free, right? All the kind of small things
Mm-hmm.
that can often be difficult for us to get BTs to do. And then from there, we are really interested in document quality and quality assurance. A lot of these big organizations have the leverage, right, to bring on these massive quality assurance teams. But if you're sort of a smaller practice, you as a
Mm-hmm.
clinician, you as a clinician owner are the ones doing it. And so we want to use AI to also be reviewing parts of the
Sure.
treatment plan, session notes to make sure that documentation that gets sent off to insurance is really high quality. And then we're working on the video component because we do think if you can put a video camera in the corner of a session and be able to capture the learner, capture the technician, you can start to do really amazing things beyond checking to make sure your BT is actually doing data collection correctly, but also doing treatment fidelity in an automated way where previously you
Mm-hmm.
had to kind of do your own data collection on the paraprofessional to do that right. Now maybe we can do that automatically with video and AI. And so we're really interested in how video can change how we think about the reporting and the quality and the tracking and the training of paraprofessionals.
And then there's there's something called reactivity in our profession, in that anytime you institute a video or somebody else watching or an audio thing and somebody knows they're being recorded, their behavior changes.
Yeah.
So that's always an interesting, if you know you're not being videotaped, then you do things
Yeah.
differently than if you
Yeah.
do that.
Hopefully for the better, right? Kind of
Yeah,
BTs on their
hopefully, yeah, hopefully for the
BTs on
better.
their phone no more because they realize,
Yeah,
oh,
that's true. Because
an
they're like,
AI
oh, I'm
is
being watched
watching me.
all the time. Yeah, but you also have to watch with the client, because if they are affected by the video, sometimes
Yeah.
that happens. Sometimes it's a better thing, and sometimes it's. But it's
Mm-hmm.
interesting the way. I mean, there's just lots of studies on how that the institution of that actually changes behavior.
Yeah. Or even an iPad in session, right? Like a kid who really likes using the iPad will grab the
Yeah,
iPad and
all of a
start
sudden,
playing with it. It's like, oh no,
Mm-hmm.
this is not supposed to
wrong with
happen,
that.
right? Um,
Yeah.
yeah.
Yeah, we dealt with that a lot when I was in my last company when we were building out data collection platform. I'll never forget. I went into a room, I visited a client when I first started, first 6 months, and uh, they were touring me around their center. And we went into this one room, and it was covered in foam pads, like
Yeah.
all the walls and everything. And then there was maybe like 4 kids that were running around, and then there was these girls. They were like, I was like, they had to be 21 to 24 years old, and they had elbow pads, shin pads, wrist guards, like everything. And I was like, wow, like an iPad does not belong in here. Like we need to figure out another solution. Like that is a fragile piece. And yeah, it was just like really eye-opening to be like, okay, this is going to be some like an interesting problem to solve. How do you take accurate data without a computer?
Yeah.
So
Yeah.
yeah, yeah. So yeah, it's really interesting. What else? Do
Can
you have
I
anything
add?
you want to talk about?
Well, I was going to ask you guys a question.
Sure.
I'd love to know how y'all are thinking about AI in the roadmap or not on.
Yeah. We have thought about it. We do have some plans. Um, have to walk a delicate line, I think, because when you start suggesting things with AI, even if it's diagnoses, if it's changes to intervention, if it's uh, possible programs to work on, things like that, you start getting into this gray medical device area that we kind of need to be sure that we're on the correct side of if we don't then become a medical device company.
Right.
The summarization and things like that, we've toyed with the idea. I have some ideas about it, but we haven't really felt a huge need at the moment because the majority of our session notes that our clients put out, which I think in the last time I looked, we did in the month of September, we had over like 2.4 million session notes completed. And with all of those, the majority of the data that they're writing in is dynamically input to a template. So they're not having to do anything. First name, last name, payer information, like all that stuff. All the raw data, all the graphs. So they're really just writing the summary part. And we just haven't gotten a ton back, and we don't think there's enough value yet to introduce it. But we have been looking at it more of like an agnostic from the raw data side. So to say like with some demographics included, but like you could start to see trends in data based off of certain intervention changes, whether that's length, whether that it could be about a lot of different things. So then you get to the point of, well, you're writing a treatment plan. You've included all of these goals based off of this child's past X years or whatever data we have on him. We think you might be shooting a little too high here. You might not be able to complete the entire treatment plan based on how fast this child learns, things like that, right? So that's not necessarily suggesting that, hey, we think you should work on reducing this behavior because we saw it in the assessment, right? That's not suggesting something we work on. And it's not necessarily diagnosing anything. It's just saying, based off of all the data we have prior and how fast you completed those goals, now you're trying to do something else. We either say, hey, you might be able to add some more here, or maybe you have too much. So all those ideas we've kind of thought about, we're throwing around, but nothing yet has hit the roadmap yet at the moment.
It's really interesting. Cool. Well, I'm excited to see what you guys come up with too.
Yeah. It would be interesting to like fast forward a year and see where we're at, because I have a feeling we'll be in a completely different place, because last year we were in a completely different place. So things are moving fast, and that's kind of the beauty of the startup world. So, well, thanks so much. We appreciate your time. This is a great chat. Great to learn about Alpaca Health. And if anyone has questions, I'll leave your website in the show notes, which I believe is alpacahealth.io. Is that right?
Yeah, that's right. Yep.
Cool. So I'll put that in the show notes in the description. And thanks again. Appreciate it.
Sounds good. Nice to meet you guys. Thanks for having me.
Thanks a lot.
Bye.
Bye-bye.